Are tear trough implants a permanent solution for hollow eyes?
We routinely see patients complaining of under-eye hollows and dark circles. I generally address this issue with hyaluronic acid fillers as well as PRP, or platelet-rich plasma. This modality has been a major advance in my ability to help a wide range of patients who did not have this option many years ago. Interestingly, patients do often inquire about permanent options, such as permanent fillers, fat grafting, and facial implants, such as a tear trough implant. Prior to the introduction of hyaluronic acid fillers, I did perform placement of fat grafting as well as silicone tear trough implants. So I can provide some perspective for those who are experiencing filler fatigue. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. Let's start with the subject of permanent fillers. Permanent fillers, such as injectable silicone, PMMA, or calcium hydroxyapatite, are difficult to impossible to fully remove if there were to be an infection or foreign body reaction. In contrast, hyaluronic acid can be reversed with the placement of an enzyme called hyaluronidase. As far as fat grafting is concerned, in our field, fat grafting has been considered the ideal filler, since most people have some fat that can be harvested in quantities far greater than what is typically used when placing injectable fillers. Unfortunately, particularly in the under-eye areas, fat grafting can be problematic. The term graft means that there is no blood supply, and there is a reliance on the tissue where the fat is transplanted to provide a blood supply so that the fat would survive. This is a problem since some of the fat may survive while other grafted fat will not. This can result in surface irregularities and cosmetically undesirable outcomes. I'm routinely seeing patients from around the world who come to me to have me surgically remove these fat grafts from underneath their eyes. This procedure can be technically challenging and potentially requiring multiple procedures in order to maintain proper eyelid support and function. Predictability of outcome is very important, and most people who I see have limited time and tolerance for unanticipated issues. In the early years of my career, I performed a lot of facial implant surgery, including the placement of silicone tear trough implants. We have learned more over the years in that although the implant itself will remain intact, there are significant changes that occur with normal aging, affecting the bone structure and overlying soft tissue. So, although the implant may be permanent, the human body continuously changes. This means the implant is not truly a permanent solution, since it does not change with your body. I have been very impressed with the application of facial implant principles when using hyaluronic acid fillers. Although there is often a lot of interest in the names and types of hyaluronic acid fillers that are on the market, I cannot emphasize enough the importance of technique. Anatomically speaking, I generally place hyaluronic acid fillers with different viscosities at the bone level in areas such as the tear trough, cheekbones, chin, and jaw angles. In doing so, the fillers typically will actually feel like bone. We refer to this approach as structural volumizing. I perform these procedures in my exam rooms with blunt cannulas, thereby reducing the risk of bruising or vascular complications associated with only using needles. Our patients often have these procedures done during their lunch hour and are able to go right back to work. Hyaluronic acid fillers are safe and metabolized naturally by the body, and when placed with this technique, have a tendency to last a very long time. Although they are not permanent, the placement of these fillers with syringes and cannulas allows for very accurate adjustments in a way that permanent implants, such as a tear trough implant, cannot be done. At this time, as a surgeon, I am delighted to perform these procedures safely, predictably, and with the option of reversibility while getting results that appear as if surgery was performed. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situation, you may contact our offices through our websites or call to schedule a consultation. Thank you.